Happy holidays, and thank you for joining me this Sunday. Given the exacerbating situation around the coronavirus pandemic, I want to begin tonight by introducing you to these frontline healthcare workers at the Dixie Regional Medical Center in Utah. This video was released earlier last week by the Intermountain Healthcare YouTube channel.
So you can see that the nurses need to spend time working with the patient to position them so they avoid bed sores. They have to rotate them every 2 hours. The patient's oxygen levels are better when they're on their belly, which is why we have the patients on their belly in some cases.
So I'm a respiratory therapist for 15 years, and this has been one of the most overwhelming times for all of us.
It's just the little things that make a huge difference. By not washing your hands even one time, you can potentially change someone's life forever. People die every day. And it's all preventable, all of it.
I know at this time in life, sometimes we feel like everybody's trying to control us and tell us what to do. It doesn't hurt anything to wear a cloth in your face. I know personally, working here and wearing one all day, every day has helped me, or we will all be sick.
There was a patient that was passing away from COVID, and she didn't have any family. So me and two other nurses just sat in the room with her while she passed away. And we all just kind of held each other's hands.
But then as I left the room and walked down the hallway, I found the patient's nurse and I said, "Can you go for a walk with me?" And we went into the stairwell. I broke down and I just said, "How do you do this? How do you keep caring for these patients day after day, watching them die?" And I needed that break. I needed that nurse who was my hero that day. And I'm so grateful for the team that we have here that allows us to keep caring for patients despite the circumstances that we're in.
We've had several couples come into the hospital with COVID-19, and most of the time only one of them makes it out. It's awful, and you have the power to prevent all of that.
Every day we call our patients' families because they're not all able to be here with their loved ones, and we give them an update on their conditions. Regularly, their family members give us sincere gratitude and thanks. We appreciate that gratitude. We appreciate that thanks. And we feel it. We feel that benefit. Will you help us? Will you please do all that you can to stay safe? Keep your mask on. Stay socially distant apart while still expressing love for one another. Get your flu shot. Stay home when you're sick. And please, do your best to help us all as we work through this, but most importantly, to help these patients who are here suffering. That would be the best thank you that we could appreciate. Thank you.
That would be the best thank you that we could appreciate. Once again, that was a video released earlier last week from the Intermountain Healthcare YouTube channel. Now, that was not the full video. We did edit some parts out, but if you want to watch that full video, you can find it on their YouTube channel. The video is titled Courage on the Front Lines, Episode 3. In Utah right now, the Salt Lake Tribune is delineating the coronavirus pandemic as one of the deadliest events to transpire in the state in 100 years. And of course, about 102 years ago, the 1918 Spanish flu transpired. That is essentially what the paper is citing as one of their last major pandemics to hit that state, one of just the deadliest events. But the current situation in the state right now is just getting worse. Today, Utah reported 2,083 new coronavirus cases and 17 deaths. Right now, their ICUs are at 96% capacity. One doctor said that the ICUs are brimming over, and this was, quote, mathematically inevitable, end quote. When that doctor said that, that doctor actually cited the surge in coronavirus cases after Halloween. However, they said that the surge in cases after Thanksgiving was not as large as they feared, so that is some good news in terms of patient care and ICU beds available. According to Fox13now.com, Utah is on the trajectory doubling their coronavirus deaths within the next 10 weeks. Also, in Utah right now, an ICU nurse is being hospitalized after contracting the coronavirus. Reportedly, her lungs are continuing to decline and she's needing more oxygen. Obviously, we are hoping for the best in any of these difficult circumstances. Florida is also seeing a surge in coronavirus cases, and they have been for a very long time. The governor of the state is a Republican Ron DeSantis, a sycophant for the president and a very close ally of President Donald Trump. But in that state, multiple newspapers have been essentially writing deeply moving editorials urging the governor to take more action. For instance, you may recall we did a segment back on this show back in August about the South Florida Sentinel essentially urging the governor to issue a mask mandate. Well, that same newspaper conducted an internal investigation about what was going on in their state and why the numbers were getting so bad. It appeared on the front page of that newspaper. This was the headline, quote, "Secrecy and Spin, How Florida's Governor Misled the Public on the COVID-19 Pandemic," end quote. So this paper was released 2 weeks ago. Here's the article, quote, "Throughout the COVID-19 crisis in Florida, Governor Ron DeSantis' administration engaged in a pattern of spin and concealment that misled the public on the gravest health threat the state has ever faced. A South Florida Sun-Sentinel investigation has found DeSantis, who owes his job to early support from President Donald Trump, imposed an approach in line with views of the president and his powerful base of supporters. The administration suppressed unfavorable facts, dispensed dangerous misinformation, dismissed public health professionals, and promoted the views of scientific dissenters who supported the governor's approach to the disease. The DeSantis administration's approach to managing COVID-19 information carries cost. It supports a climate in which people proudly disdain masks, engage in dangerous group activities that could spread the disease, and brush aside information that conflicts with their political views. With partygoers packing Florida bars and holiday travelers filling hotels and guest rooms, the state faces a few difficult months before the possible relief of vaccines. The Florida Department of Health's county-level spokespeople were ordered in September. This is astonishing. Ordered in September to stop issuing public statements about COVID-19 until after the November 3rd election. The DeSantis administration refused to reveal details about the first suspected cases in Florida, then denied that the virus was spreading from person to person, despite mounting evidence that it was. State officials also withheld information about infections in schools, prisons, hospitals, and nursing homes, relenting only under pressure or legal action from family members, advocacy groups, and journalists. The DeSantis administration brushed aside scientists and doctors who advocated conventional approaches to fighting the virus, preferring scientists on the fringes who backed the governor's positions. The governor's spokesman regularly takes to Twitter to spread misinformation about the disease, including the false claim that COVID was less deadly than the flu. The governor highlighted statistics that would paint the rosiest picture possible and attempted to cast doubt on the validity of Florida's rising death toll. Quote, "Clear, consistent, and transparent messaging. One person is saying that it is important to have clear, consistent, and transparent messaging." She goes on to say, quote, "If you don't do that, then people won't trust you about your behavior," end quote. So, that was a lot to take in, but this is basically what the South Florida Sentinel, the South Florida Sun Sentinel, found in their investigation. Dr. Jay Wilson, Senior Associate Dean at the University of South Florida's Morsani College of Medicine, said, quote, "Florida is one of the top states in the nation for expertise to draw on. Unfortunately, at the state level, I'm afraid we are not being heard, and evidence-based data is not being used as far as decisions are being made," end quote. The governor's press secretary said that the governor believes in wearing masks, just not mandating them. The mayor of Miami Beach, Dan Gelber, has said, quote, "He has these press conferences where he says how great everything is. It's more like an Amway meeting than an emergency management meeting. This consistent refrain of how well everyone is doing It's so the wrong approach. End quote. This investigation also found that some COVID-19 deaths in Florida went unreported for 2 months. I mean, this is just absolutely astonishing. That was not the full article, but I absolutely encourage you to actually read the full thing. It is intriguing and unsettling. Today, it is believed that Florida Democratic Representative Carlos G. Smith essentially tweeted a quote from an article that was posted by the Miami Herald today. That tweet was, quote, "A White House coronavirus task force report about Florida urges state leaders to take immediate action to slow the spread of the coronavirus, close or severely limit indoor dining, limit capacity at bars, and issue stronger policies around mask wearing." End quote. So it is likely that information did come from the Miami Herald newspaper out of Florida. We also know that according to public reporting that Florida's Governor Ron DeSantis is flat out just refusing to even release that information to the public, just in case anyone wants to know if they should be traveling or going out. I mean, this White House coronavirus task force also says that Florida is in the, quote, red zone, end quote. And it also provides Florida some recommendations, a list of health recommendations for the state. I'll make sure to link that article in the description of this, that report in the description of this episode for you to analyze and to absorb that information. You may recall a segment we did on this show back in June, I believe, about a Florida scientist who was fired for refusing to manipulate the state's coronavirus data. Well, earlier this week, her home was raided by the police. This was reporting from ABC News on Friday.
There is new video tonight showing the search warrant executed at the home of a Florida scientist who was the coronavirus tracker for the state of Florida. She says she was fired in retaliation for public comments about COVID-19. Tonight, hear the new images showing her pleading with officers not to point their guns at her children. And tonight, hear what authorities, including Florida's governor, are saying about the raid. Here's Rachel Scott.
Police, search warrant, open the door.
Tonight, new police body camera video released of that raid at the home of a Florida scientist.
Outside.
Rebecca Jones, a former state coronavirus data tracker, recording that encounter too, making it public earlier this week.
Do not point that gun at my children.
You can hear her claim police pointed guns at her children who were upstairs. You can see one officer pointing his weapon in that direction. The raid part of an ongoing investigation into a hack of the state's Department of Health internal emergency alert system. Officers seizing her electronics.
I mean, it's a political just shakedown and a way to try to shut me down.
Jones once ran the state's COVID-19 dashboard. She was fired in May. She says in retaliation for claiming the department was doctoring COVID-19 data at a time when the governor was trying to reopen the state. The governor says she was fired for insubordination, defending the officers today.
These people did their jobs. They've been smeared as the Gestapo for doing their jobs. They did a search warrant.
The Florida Department of Law Enforcement releasing that body cam video saying the officers exercised extreme patience. Tonight, the investigation into that hack is still ongoing.
Just absolutely astonishing. That was a video released earlier this week from ABC News. That was their reporting on that astonishing raid earlier this week. On Tuesday, that Florida scientist tweeted this, quote, "Got new info tonight. The judge who signed the search order for my house was appointed by Governor Ron DeSantis and sworn in less than a month before he signed that warrant. In civil court, he's not even a criminal so she's saying in her tweet that this was done in civil court. Quote, "He's not even a criminal court judge. It was one of his first actions as judge." End quote. So once again, this astonishing raid in Florida at this Florida scientist's home. Also, this new internal investigation by this newspaper in Florida saying that, yes, there was secrecy and spin on the coronavirus pandemic. And also, did you know that the governor of Florida just decided, hey, we're not going to report deaths. Deaths went unreported for literally 2 months in that state. Astonishing situation. In Kansas, the House leader is warning members of the state's legislative body as one member has just tested positive for the coronavirus. In a statement, Republican House Speaker Ron Rickman said, quote, "We have received word that a case of COVID-19 has been confirmed among those attending the legislative pre-organization meeting on Monday. People who were in close contact, defined as being within 6 feet for 10 minutes or more, have been notified that they are a close contact and will be monitored by public health." End quote. On Friday, USA Today reporters published this article, the headline reading, quote, "A small town dragged its feet on COVID-19 mask mandates. Now residents are paying the price. In communities where mask wearing has become a political inflection point, the toll of the virus has surpassed the dark spring in American cities." End quote. Here's the lead on that article. Quote, "In the midst of a worsening pandemic, as coronavirus cases climbed, elected leaders in a former frontier town famous for its gunfight faced a choice." Then it goes on to say, quote, "They could pass a mask mandate at the urging of public health experts or reject the measures blasted by some as a violation of their personal freedoms." End quote. So, two choices. And as you know, early on in the pandemic, the president began politicizing masks. And that politicization of the coronavirus pandemic and the wearing of masks did not only encourage his supporters not to wear masks, but others as well. It is likely that that politicization also led to the exacerbation of the coronavirus pandemic, explains why we are still here right now. Why things are getting worse when other countries are reopening or other countries are shutting back down. And we have been just getting worse this entire time. So, this has affected us across the entire country. And so, what did they do in Dodge City, Kansas? Quote, "The 5 commissioners of Dodge City, Kansas, a politically red cattle community of some 20,000 people, had resisted such measures all summer and into fall." End quote. And so when you do that and just brush it off and finally decide to do something, A, it's probably going to be too late, and B, the second wave will come roaring back with long-term ramifications, and that's exactly what happened. Quote, "A second wave hit Dodge City. People started getting sick again. By the time commissioners passed the mask mandate on November 16th, more than 1 out of every 10 county residents had contracted the virus. At least a dozen of them had died." End quote. I'll make sure to link that article in the description of this episode. But the good news is that Kansas is now seeing a 5% decrease in new coronavirus cases, so that is good news. Today, this was the headline at the Star Tribune out of Minnesota. Quote, 3,439 more COVID cases, 85 new deaths in the state of Minnesota. End quote. The situation in Minnesota right now is dire, and it's just getting worse and worse. I mean, looking at the Star Tribune headlines out of that state now is just grim and unsettling every day. In California, cases are rising 53.8%. According to CNBC, 10% of the state has officially opted into coronavirus exposure alerts. Now, this is something that essentially has been going on in many other states as the situation is exacerbating. So people in California now be getting push notifications when they need to urge the public to, hey, get more serious on coronavirus. According to USA Today and Johns Hopkins University data, California ranks number 16 for the state where the coronavirus is spreading the most in terms of person-to-person transmission. Yesterday, Sarah Dorn reported at the New York Post that an entire region in California is out of ICU beds as coronavirus cases are continuing to skyrocket in that state. Quote, "As a 12-county region in California is out of ICU beds, is out of ICU bed capacity as a second wave of COVID-19 rages through the state's rural Central Valley. San Juan County, an agricultural hub where the majority of fruits and vegetables in the United States are grown, has been hit particularly hard in recent weeks. ICU capacity at all 7 hospitals in the county stood at 100% on Saturday, the highest rate anywhere in California, according to the state's Department of Health. A team of 17 nurses is expected to arrive Monday at one local hospital that has built a second ICU area where it plans to take in coronavirus patients from San Juan County's 6 others overflowing hospitals. Many of the patients are Latino farm workers. A doctor at Adventist Health Lodi Memorial Hospital in Lodi, which is about 100 miles east of San Francisco, said that during the first coronavirus wave in the spring, 75% of patients were Latino. End quote. So you can see here in terms of these racial disparities and who's being affected the most by the coronavirus. Because of the exacerbating situation in California right now, in California hospitals right now, NBC News actually did a report from California in an ICU on Thursday.
Every day, thousands more arrive at hospitals across the country. Fueled by another single-day record of new infections, medical centers like Providence St. Joseph near Los Angeles have seen COVID admissions triple.
I think 10 has to go on a vent. He doesn't look good.
NBC News given exclusive access inside their COVID ward.
We've never had to treat so many sick patients at the exact same time.
Every bed in this ICU wing is filled. Doctors,
Can you recycle?
nurses, and a web of drips and pumps struggle to keep a growing number of young patients alive.
How quickly can people go from sick to ICU?
24 hours. And even less. I've had patients come in not requiring any supplemental oxygen, just high fever, don't feel well. Within 24 hours, they're intubated in the ICU.
Across the country, a record number of Americans died Wednesday. Down the hall, Nurse Mane Abrudan is losing another patient.
There's a very good chance that he may pass without the family being able to say goodbye.
How much time do you think this patient has?
Don't think past midnight.
The team here is aware of the mobile morgues outside Dallas, the 6 hospitals reaching capacity in Michigan, and the 10 rural counties in California out of ICU beds.
The staff here, like at so many other hospitals around the country, are exhausted. The days are 12 hours long, and the shifts are 12 in a row.
The sacrifices made are also personal.
I don't get to see my mom because I'm scared they might get something from me. So we're all doing our part and we're just hoping everybody will do the same. Sorry.
Inside one of the hospital's most restrictive areas, we met Jose Bonilla, who says he felt like he was drowning when he was admitted. Tonight, so many on the front lines feel like they're underwater.
What's the hardest part?
I think not knowing when this is going to end.
The end still far from near. Miguel Almaguer, NBC News.
Once again, that was an NBC News report on NBC Nightly News on Thursday this week out of a California ICU and in a hospital. On Thursday, a Texas candidate for the judgeship died of the coronavirus. She was 47 years old. On Friday, this was the headline at the Texas Tribune, quote, Texas healthcare workers say latest coronavirus spike is crushing them, end quote. One doctor told the Tribune, quote, you see people dying every day. No matter how hard you try, there's nothing much you can do. You know they're going to die, and you just try to do your best to see if you can save lives. I'm looking at them crying. I'm looking at them saying their last goodbyes, end quote. Today, this was the headline at the Austin American-Statesman newspaper. Quote, as virus rages, Texas intensive care units at the brink, end quote. Here's the lead on that article. Quote, a fall coronavirus surge in Texas that is showing no signs of abating has taken its toll on the hospitals across the state, with intensive care unit beds in critically short of supply, raising grave concerns about the ability of the state's healthcare system to properly treat patients stricken with the COVID-19 as well as other illnesses, end quote. We know that at least 50 hospitals in Texas are at more than 98% capacity, including 27 with completely full ICUs. Also, dozens of cities in Texas are at more than 90% ICU capacity, including Houston, Texas, Dallas, Fort Worth, San Antonio as well. That is according to an analysis of data conducted by the University of Minnesota's COVID-19 Hospitalization Tracking Project. Today in Virginia, they reported 3,294 new coronavirus cases. Reportedly, new limits on public gatherings have been issued. Also, a curfew is said to be underway in that state as the situation is getting worse. In Rhode Island, as they are seeing a surge in coronavirus cases, the state health director has tested positive for the coronavirus, and the governor is now quarantining. In Massachusetts, they are now rolling back their reopening phase as the state is seeing a surge in cases. Local leaders are now advocating for more coronavirus restrictions. They reported today in Massachusetts, 158 Massachusetts communities are now in the red zone. 158 Massachusetts communities are now in the red zone for the coronavirus. Today in Oklahoma, they reported 4,332 new coronavirus cases and 22 deaths. Their governor, Kevin Snitt, has just announced new limits on public gatherings as the situation there worsens in that state. We're going to have more reporting on this situation in Oklahoma this Wednesday. The situation right now is dire, nationally, locally, and when you look at it through the lens of different states. Right now, more than 298,000 Americans are dead, more than 16 million Americans are infected, and more than 108 Americans are hospitalized from the coronavirus tonight. God bless our healthcare workers, because we are in a terrible position right now. I mean, yes, there is good news. There is hope that the vaccines, there is hope and exuberance today as vaccines arrived for the first time this historic day. But the situation in the United States right now from the coronavirus is dire. And as we are continuing to battle this coronavirus and wait for the new administration to be sworn in, we get sort of this new hopeful and sort of exhilarating news that has been adulated among lots of the health community. Earlier this week, Joe Biden decided to choose Rochelle Walensky as his CDC director. This was essentially the headline at the Boston Globe when he decided to do that. Quote, Rochelle Walensky and the return of competence. This is the subheadline. Quote, after a parade of sheep and charlatans posing as White House endorsed public health officials, Joe Biden's selection of Rochelle Walensky to head up the CDC suggests the conviction and competence are back in the vogue in the Beltway. End quote. It has been a terrible week around the news of the coronavirus. But hearing this news and hearing the news about the vaccine, supposedly that may be helpful here. That may provide us a glimmer of hope as the current situation is exacerbating. In that NBC News report, you heard this California, essentially healthcare worker say, yes, people are dying every day. That doctor in the video that I played at the beginning, saying that would be the best thank you that we could appreciate if you just wear your mask and stay safe. We are in a terrible time right now as a country. Coronavirus cases are continuing to rise exponentially, but we can get through this together if we just listen to our frontline healthcare workers, continue to adulate them during this difficult time, and do the best we can to avoid transmission and contraction of this deadly infectious disease. We got more to come tonight. Stay with us.